Hello everybody, I am Dr. Sanjeev Rao Girimaj, consultant physician, Apollo Hospital, Mysore. We are seeing a surge in COVID cases. We are seeing lot of our own people reporting with COVID. When I mean lot of our own people, it is literally everybody has got a friend or a relative who has turned positive with COVID, who needs hospitalization. We have come across reports in the media, social media, as well as the mass media, where people are struggling to get beds, people are struggling for oxygen, people are struggling for ICU care. This is the kind of a surge that has never been seen before. As we face this surge, let us understand one thing: prevention is the best cure. We need to prevent COVID rather than seek treatment after developing this. Unfortunately, as I see, people have become callous after the first wave, forgotten the three basic essential things: mask, social distancing, hand sanitization, which are very effective and very essential in preventing the progression of the disease and preventing further spread of the infections. In this regard, I appeal to everybody that whether you are vaccinated or not, please ensure that you follow the basic three steps of social distancing, wearing mask always, and hand sanitization whenever you come across any surfaces. These three things are absolutely essential in preventing. We have had hundreds of thousands of healthcare workers working in COVID environments, working in COVID centers, who have never developed an infection only because they have been following these three things. If we have to prevent the second wave, further progression of the second wave, we have to prevent the third wave, these three are the only steps. Equally important in this regard, let me bring across to you another point, equally important point. There are a lot of people who need emergency care, who are hesitant to come to the hospitals with an irrational fear of COVID. We have had patients who have developed bleed in the brain, patients who have had stroke, patients who have had heart attacks, ignoring the symptoms, thinking that they could be just gastritis or some other simple disease, just because they are scared to go and get evaluated in the hospital. These emergencies can be life-threatening. So please, if at all you require any other health care other than COVID, do not hesitate to come to the hospitals. Do not hesitate to go to your doctor and seek the health care. We at Apollo, we try to ensure that there is complete segregation of infected patients who come with fever, cough, and people who come with non-fever, non-cough emergencies. Every effort shall be made to segregate them and ensure that there is no risk to the patient. Equally important on your side, timing is very important. The late the patient presents, the less chances of recovery or less chances of completely regaining back their previous health. Please understand this and take precautions. Thank you.